Brush Away Your Problems, a theory-based intervention program by Katelyn Madrid. Here's the overview. This intervention will focus on brushing and flossing teeth. It has a goal of understanding why or why not students brush or floss their teeth, as well as minimizing plaque and calculus, tartar formation, periodontal disease, and gingivitis in NAU student population. This intervention will examine both social and health benefits to good hygiene, as well as teach it. It will consist of 4 activities and will be assisted by NAU's Housing and Residence Life, Dental Hygiene Program, and College of Health and Human Services. For the setting, population, and health issue, the setting is Northern Arizona University residence halls. Why? The act of brushing one's teeth is often forgotten while students are living in dorms on college campuses. There are both social and health benefits, which include social status, likability, reputation, decreased amounts of related health problems, to having good hygiene, that are often overlooked. For the target population, we're looking at students of Northern Arizona University, ages 18 through 24, that live on campus. Why? This population group is more susceptible to the information presented in the intervention program. While living in the dorms, these students are required to attend floor meetings and complete housing surveys, which I could utilize in my intervention program. Data will be more easily collected from on-campus students than off-campus students. The health issue we're looking at here is plaque and calculus, tartar formation, periodontal disease, and gingivitis. So let's look at some epidemiological data. The American Dental Association and British Dental Association both recommend an oral health regime which includes daily flossing and brushing to remove interdental plaque and prevent calculus formation, periodontal disease, and gingivitis. Despite evidence that the combination of flossing and toothbrushing prevents gingivitis more effectively than toothbrushing alone, daily flossing rates are low. The most common diseases that impact our oral health include tooth decay, gum disease, and oral cancer. It's important to know that tooth decay can also be called cavities, and gum disease is also referred to as periodontal disease. Although tooth decay is largely preventable, about 1/4 of young children, half of adolescents, and more than 90% of adults experience tooth decay. Tooth decay is caused by a breakdown of the tooth enamel by acids produced by bacteria located in plaque and calculus that collects on the teeth. Gum disease is mainly the result of infections and inflammation of the gums and bone that surround and support the teeth. For theory and application, the individual level theory that I will apply to brushing and flossing teeth is the health belief model. The social behavioral level theory that I will apply to brushing and flossing teeth is the social cognitive theory. I have reviewed my intervention program for replicability, and the program components are original and unique to my health behavior. I plan to connect the setting, population, and health issue by using a theoretical approach that is tailored to NAU students who live on campus. These students will participate in program activities that support constructs from the health belief model and social cognitive theory. They will learn both the social and health benefits to brushing and flossing teeth. I will partner with NAU's Housing and Residence Life, Dental Hygiene Program, and College of Health and Human Services to successfully connect my health issue to my population and setting, and also implement the intervention program. Brushing and flossing teeth will be looked at on both an individual and social behavioral level. On the next slide, you will see the program components used with the constructs. When looking at the program activities and constructs, please pay attention to the key ideas that are highlighted in yellow. For my first program activity, it would deal with perceived susceptibility from the health belief model. It would be a group activity where sticky notes would be placed under certain chairs and would represent a person with plaque, calculus, periodontal disease, or gingivitis. The people with sticky notes would stand and represent the statistics of how many people are affected by negative health consequences of not brushing teeth or flossing. This activity would get people to see their susceptibility and influence behavior. This activity could be performed by residential assistants, RAs, during floor meetings, or dental hygiene students could couple this activity with a lecture on good dental hygiene in public health courses. For my second program activity, it will deal with cues to action from the health belief model. Having a guest speaker who has suffered from negative health consequences of not brushing their teeth or flossing would show people the effect it has on real people and motivate people to change. For example, if the guest speaker has lost teeth, participants may be more inclined to brush their teeth and floss in order to avoid losing their teeth. The guest speaker could attend a public health course as a guest lecturer. For my third program activity, it would deal with self-control from social cognitive theory, a group activity where participants look at the amount of plaque on their teeth prior to brushing them and look at their teeth after. Participants would see much less plaque after brushing their teeth, and this shows they have control over the health of their teeth. RAs could drop the necessary supplies at their residence rooms, and students could conduct this experiment on their own, or dental hygiene students could conduct this experiment in public health courses. For my fourth and final program activity, I would look at reinforcement from social cognitive theory. This would be a group activity where people could share their morning or night routine that includes brushing teeth and flossing. These participants could receive gift cards as positive reinforcement, and it would motivate other participants to want to make a morning or night routine that promotes oral hygiene and health. This could be a competition between residents in different halls or through BB Learn discussion boards in public health courses. These 4 program activities will connect the setting, population, and health issue by using a theoretical approach. To evaluate this intervention program, we will be using the logic model. In the logic model, we will look at the priorities, inputs, outputs, outcome, and impact of the program. For the priorities, we need to consider our mission, vision, values, mandates, resources, local dynamics, collaborators, and competitors. We also want to consider our intended outcomes when developing this program. For our inputs, we are going to need staff, volunteers, time, money, research, materials, and partners. We have already identified our partners as NAU's Housing and Residence Life, Dental Hygiene Program, and College of Health and Human Services. For our outputs, we're going to look at both activities and participation. First, starting with the activities. We are going to conduct group activities, which consist of the sticky note, plaque amount, and morning and night routine activities. We will host guest speakers, develop products, curriculum, and services, as well as work with partners in the media. For participation, we will reach participants, which are the NAU students, clients, agencies, decision makers, which include Rita Chang and the College of Health and Human Services Dean, as well as resident hall staff. Finally, we will look at our outcomes and the overall impact of this program. We will look at them in short-term, medium-term, and long-term outcomes. For our short-term outcomes, we have access to oral health information, awareness of oral health problems, and motivation to brush and floss teeth twice a day. For our medium-term or intermediate outcomes, we have sharing oral health information, practicing good oral hygiene, and brushing and flossing twice a day. For our long-term outcomes, we have students' likability increases, more friendships are made, the overall health increases of the student population at NAU, and at least 50% less cases of plaque, calculus formation, periodontal disease, and gingivitis is present on NAU's student population. In conclusion, I sourced my information from NAU's Klein Library and the Centers for Disease Control and Prevention.